Jamie, I think we're going to make a start now, okay?
Yeah.
Brilliant, thank you. So good afternoon, everybody, and thank you so much for joining us this Wednesday lunchtime. Hope the sun is shining for wherever you are. It's currently quite overcast here down in Devon. And thank you to those watching the recording as well. So today we'll be presenting the findings of the secondary analysis of Activity Alliance's annual Disability and Activity Survey, which explores regional and demographic influences on disabled people's experiences of sport and activity. So this webinar follows the release 2 report, which was released on our website on Monday, of which the links will be provided in the chat in due course. My name is Jake Netherway, and I'm a Senior Research and Insight Advisor here at Activity Alliance, and I'm being supported by Jamie, who's controlling the slides, Imogen, who's in the chat, and also delighted to be joined by Rose Fawcett, who is a data analyst, Laura Horton, who is the Programme Manager for Get Yourself Active, which is a programme led by Disability Rights UK, and James Timmons, who is a Health and Inequalities Officer at Be Active, which is the local active partnership for Bedfordshire. So for those who don't know Activity Alliance and have not attended 2 of our previous webinars that we've hosted this year, we are a national charity that work to close the gap between disabled people's level of physical inactivity and that of non-disabled people. And our vision is for a future where all disabled people feel they belong in sports and activities. We will work with disabled people and an alliance of committed partners to build that movement for change. Within that vision, and to realise that vision, we have 3 key ambitions. The first of which is for sports and activities to meet disabled people's needs. Second, for disabled people to influence campaigning, policy and decision making. And third, to address inequalities by working with others. Next slide, please, Jamie. So today, over the course of the next hour, we'll be going through the findings of this secondary analysis, of which Rose will present an overview of the methodology and key findings. Next, all being well, Laura will go through plans to explore regional insight and localized disability data. However, Laura does have a tooth infection, so we'll see how Laura goes. And third, James will go through some of the insight and key learning points from a local annual disability and activity survey pilot, which was surveyed earlier this year across Bedfordshire. And then finally, we'll finish the session with some key take-home messages and how we plan on using this insight moving forward to support the physical activity sports sector and more widely. Move forward, Jamie. So a little bit of housekeeping before we get going. So you will be muted and your camera will be off for those of you in attendance, and live captioning and BSL is available, of which Gloria should be kindly spotlighted for you now. There is a message from David in the chat. Hopefully that's been resolved, but Jamie, please, can you take a look at that in the chat? If you aren't able to attend, which obviously you are, for those not in attendance, this will be recorded. So please share this recording when and with your partners when it's launched on the Activity Alliance website and YouTube channel. And if you have any questions, please post them in the comments or chat box. And we have Imogen monitoring that chat to answer any questions with our support. If you have any other questions as part of this webinar, which we don't get round to answering throughout this hour, we'll follow up with an answer sheet, which will be circulated to all event attendees with other post-event information. And if you've got any issues, please pop them in the chat box. And if you have any problems accessing this webinar, we'll do our best to support you with that today. Next slide, please. So a bit of background around the annual survey. This survey complements Sport England's Active Lives survey, from which we know that disabled people are almost twice as likely to be inactive as non-disabled people. And this is something that we call the activity gap. So the annual Disability and Activity Survey, which we abbreviate to ADAS, tracks disabled people's perceptions and experience of sport and activity across a range of themes. This includes taking part and participating in sport and activity and disabled people's experience of being active, the legacy of COVID-19, cost of living, outdoor spaces and outdoor travel, sources of advice and information for getting and being active, mental well-being and loneliness, and representation and belonging in participating, working, and volunteering in sport and activity. And the general message is that since the survey began in 2019, there have been few positive trends in disabled people's participation and experiences. And in previous years, it found that disabled people felt forgotten as we recovered from the pandemic, that the cost of living crisis impacted their activity levels, and that the fear of losing benefits or financial assistance prevents disabled people from trying to be more active. Next slide, please. So I'm going to pass on to Rose now, who is going to go through the methodology and the key findings of this secondary analysis.
Thank you, Jake. Hi, everyone. So my name is Rose Fawcett, and I'm an independent consultant specializing in data analysis. And I have lots of experience in the sports sector. As Jake said, the aim of this research was to explore trends in disabled people's lived experience of being physically active, and specifically to shed new light and explore trends in more detail than had so far been revealed from the ADAS data source. So far, ADAS often compares disabled people to non-disabled people, but now we're able to delve deeper and explore findings within the disabled population. Next slide, please. So these were our research questions. For each question, I've highlighted in bold the outcome that we were interested in. So for question 1, the outcome was experiences in sport and physical activity, and we wanted to see how this varies by region. For question 2, again, we're interested in experience in sport and physical activity, and we wanted to see how demographics and impairments are associated with these experiences. For question 3, the outcome was preferred sources of advice and information, and we wanted to see how this varies by region. Lastly, the outcomes we were interested in was perception of representation in sport and physical activity. We wanted to see how demographic factors are associated with these perceptions. For some of these research questions, we also explored findings for non-disabled people. But for today, everything I'm presenting focuses on our findings for disabled people. Next slide, please. So the data used was Activity Alliance's Annual Disability and Activity Survey, as Jake said, the ADAS. This builds on Sport England's Active Lives survey with an enhanced sample of disabled people. Around 50% of respondents are disabled. Each year of the data surveys a different group of participants, and the survey has evolved over time, with some questions added, some removed, but the core questions have remained consistent. Next slide, please. So the benefits of pooling the data. Pooling the data, this just means bringing together the 5 waves into one larger data set. And the benefits of doing this is that we get a larger sample size. So in one wave, there's around 2,000 participants. But when we bring those 5 waves of data together, we have around 10,000 participants. This means we have greater opportunity for different breakdowns and to cut and slice the data in new ways. I've just written out an example on the slide there. It also means we have greater confidence that the patterns we identify are real differences and they're not just occurring by chance. Next slide, please. So we use a statistical method to explore how various factors influence our key outcomes of interest. This approach is called regression analysis, and it allows us to account for the combined effects of multiple factors simultaneously. To explain this further, you may have seen analysis from descriptive statistics. For example, the rate that something is reported, and this may be higher in a certain region. However, from that type of analysis, we don't know if this is reflective of something that's happening in that region specifically, or if it could be driven by other factors, such as factors related to people within that region. So using this technique, we can isolate the unique impact of specific factors whilst controlling for other things. And the factors that we have been able to control for are listed on the screen. We also note that we only report findings that are statistically significant. So they are not just things that we see in the data that happen by chance. There's something driving that change. Next slide, please. So firstly, here we explore experiences in physical activity and how this varies by region. In terms of experience of physical activity, we define this as being captured by the 3 outcomes identified. So opportunity to be active, enjoyment of being active, and wanting to do more activity. For opportunity and enjoyment, the percentages represent the percent of people who agree or strongly agree with a positive statement on that topic. For the outcome of wanting to do more, the percent represents the percent of people who report that they want to do more of physical activity. And this is assumed to be a negative experience as they're not satisfied with the amount that they're doing currently. So as we can see, 51% of disabled people across all regions feel that they have the opportunity to be active. And any variation by region is not significant. So the opportunity of being active is consistent across regions. However, if we look at enjoyment, 69% of disabled people across all regions report that they enjoyed the last time they did physical activity. And we can see that this is higher in the East Midlands and the Yorkshire and Humber, and it's lower in West Midlands. 80% of disabled people across all regions agree that they would like to do more activity. And this is lower in the South East and higher in the North West and the East of England. Next slide, please. Here we explore demographic factors associated with experiences. We haven't written out the figures here as it gets a little complicated, but you can find them in the reports that have been published. The demographic factors here, however, are written in order of magnitude. So those written first in each box have the strongest association. So let's look at the opportunity to be active. Disabled people in the oldest age group and the youngest age group, and disabled people in high social grade are the most likely to report that they have a higher opportunity of being active. I won't go through all of the demographics here. You will be able to find the information in the reports, but to summarize these findings, I've highlighted in bold some of the groups who feature most often and with the strongest associations. So in our column for negative experiences, we can see that disabled people with a mental health impairment, disabled women, and disabled people who identify as LGBT+ are generally most likely to report negative experiences. This was a question that we also explored for non-disabled people, but we're not focusing on that here. Next slide, please. Next, the outcome we were interested in was preferred sources of advice and information. So the most popular source for advice and information amongst disabled people is to seek advice from health and social care professionals, reported by 79%. And we can see that going to this source of information is more likely in Northern Ireland and less likely in the West Midlands. The next most popular source is online sources, and there weren't many differences across the regions here, but we do see that the proportion of people who go to online sources for advice and information is slightly higher in the East Midlands. For going to advice and information from personal contacts, that's reported by 38% of disabled people, and we do observe that that's slightly higher in the northwest and slightly lower in the east of England. Going to sport, leisure, or community organisations for advice was reported by around 37% of disabled people. And we could see that that was higher, slightly higher in the northeast and Scotland, and slightly lower in Northern Ireland, the east of England, West Midlands, and London. Next slide, please. So here we explored representation within sport and physical activity and how different demographic factors are associated with representation. So the outcomes to do with representation were whether people report that they see themselves represented in different areas of sport and physical activity, and that's specifically in participation, employment, or in volunteering. Again, we haven't written out the figures exactly. Sorry, I think the light's just gone off. There we go. Excuse me. We haven't written out the figures exactly, but you can find them in the report. And again, the demographic factors are written out in order of magnitude. So for participation, the strongest association is social grade. Disabled people in high social grades are more likely to see themselves represented participating in sport. I won't go into detail of the other demographic factors, but you can find them all in the reports that have been published. Next slide, please. Now, today I also just wanted to reflect on some of the key lessons learned from doing this piece of analysis. These should be helpful for anyone else doing a similar piece of analysis. So firstly, it's crucial to define key outcomes. And when we talk about experience, what do we mean by that? So really being specific about which questions and which variables we will focus on to represent that experience. There's lots of data in this data source, and we could have done more, but it was very important to be specific and decide a few key outcomes to focus on. Next, it was a big time saver that Activity Alliance had considered consistency in the survey design. Although it may never, at the start, it may not have been the intention to bring the 5 years together. We were able to do that because Activity Alliance had thought about consistency throughout. So the same questions in different years have the same question code. If there's a new question, then it has a new question code. This makes the bringing together of the different waves much easier. Even saying this, it's important, very important to concentrate on the data cleaning step, because even though there was a high level of consistency between the waves, some things do change. You need to be very cautious that you're bringing the data together in the way that's intended. For example, some questions may be the same, but they may have new answer options added. And these need to be adjusted so that the data matches up as intended. Lastly, I hope that I explained it in a way that was understandable in this brief time, but regression analysis is not everyday language. It's not something that many people know and talk about. So it was really important that we had good conversations with Jake and Annabelle around the methodology and what it means it can tell us. And crucially, sometimes that means what we can't say from the data. Thank you very much for listening. I'm very happy to share these findings with everybody, and I will now pass over to Laura.
Thank you for that. Really insightful, and I'm hoping my next bit feeds quite nicely into how we're hoping to take some of that data to local. But before I do that, a little bit about me. My name is Laura, and I work for Disability Rights as the Programme Manager for the Get Yourself Active programme. Disability Rights is a leading national organisation run by and for disabled people in the UK. It advocates for equality, inclusion and rights, and works to influence policy and practice across key areas of life. Our core areas of work are independent living, employment and education, equal partnerships, and health and well-being. And we do that mainly by being disabled led. So most of us staff are disabled people, and the majority of our trustees also are disabled people. And we also provide support and guidance to disabled people's organisations and engage with them regularly to ensure that we have disabled people's and those with lived experience at the heart of all that we do. We provide support, and we also try and influence policy and advocacy. We advice and resources, and also campaigns. So that's our key kind of like pillars of work. And also from that, we have different programs, and Get Yourself Active is one of them. Next slide, please. So what do we do? Get Yourself Active works to increase physical activity among disabled people and those with long-term health conditions by addressing the social, structural and personal barriers they face. We aim to empower disabled people to get active in ways that work for them, use a co-production approach, putting disabled people's voice at the centre, and promote inclusive systems and changes across sport, health and social care. The key activities that we've done throughout the 10 years is co-production projects, so collaborating with disabled people to shape services and opportunities. We have recently we've produced a co-production, a shared narrative document. All of these will be available to you after. I'll make sure that the links go out. And that was just trying to address the issue that very often co-production is seen as a lucrative buzzword, and it's lost the essence of what it is. So this is a document that kind of helps and guides particularly people in this physical activity space to be able to consider co-production in their practice. We have a variety of training and resources for social workers, care providers and sport organisations. And again, our social care activity pack is something that we regularly use and promote. And again, that will be available to you. And campaigns and research, raising awareness and producing evidence to inform policy and practice. Most recently, we've produced a policy briefing paper on the latest green paper for the benefit cuts. And from that, we were able to do some extensive polling that has kind of threw up some really interesting findings and given us a real perspective on disabled people and non-disabled people's views of what the impact of those benefit cuts will have on people being physically active. We have a webinar coming up with the results and the finding and next steps on the 4th of September. Again, you're all welcome to join. So over the last 10 years, we have developed resources and work streams that we have been able to fully embed as a system partner to Sport England. But more recently, over the last year, we've been looking at how we take our learning and resources to local delivery. Get Yourself Active Local is a regional extension of the broader Get Yourself Active programme, designed to empower disabled people and those with long-term health conditions to get moving, feel well, and shape the future of physical activity through partnership working, leading to system change. One thing that's really important is that as a national organisation, we've never wanted to see that as parachuting in, that we have the answers. We will never have that local intelligence and that on the ground kind of feedback. So we initially set up a steering group, which still runs, that was made up with all stakeholders from health and social care, from people with lived experience, from the voluntary sector, and they are shaping our work in that area. And through extensive recent experience, we know that the key to improving inactivity of disabled people is when we work better together. Next slide, please. So during those steering group meetings, it was evidence that they wanted data, and taking on the brilliant work that's been done by Sport England, Active Life Survey, and then Activity Alliance's survey that which you've just heard about. We know the benefits of combining them together. However, what came apparent is that they were unable to apply that to their locality. And so very quickly they said it'd be awesome if we could have our own data set. So I approached Activity Alliance, and with the support of Jake and Molly, then they agreed that we will be able to replicate their survey, but at that local level. And hopefully not only will that give them a picture of now, it will be something as a sustainable model that they'll be able to replicate, and something that I hopefully you'll agree will have significant impact. And that's kind of like my angle of this really, is like what's the benefits of having this local data? So next slide, please. So local data helps target outreach through tailored messaging, accessible communication channels, and community-specific promotion, helping Get Yourself Active overcome the key barriers to participation. It identifies local barriers and enablers. While national surveys show broad trends, local data reveals the specific barriers disabled people face in their own communities, such as inaccessible leisure centres or parks, lack of inclusive transport and options, and gaps in local knowledge or awareness of available activities. This helps prioritise improvements that are actually relevant. We talk about a lot, having disabled people's voices. Is it something that's actually needed? Is it actually something that's wanted? And having local data can help do that. Next slide, please. So a better policy and programme design means that local data can help tailor initiatives and relevant programming, engaging formats and communication strategies suitable to local participants. It amplifies local disabled voices. By engaging local disabled people in data collection, you can create a space for lived experience to guide decision making. It aligns with co-production principles, putting people at the centre of designing solutions, and it strengthens community trust and accountability. Next slide, please. So inclusive service provision. GYA works through and with disabled people's organisations to build capacity, promote co-production, and deliver local relevant support. Localised disability data equips these organisations with evidence needed to inform programme planning and advocacy, ensuring interventions are responsive and effective at grassroots levels. Supports tailored local action plans. With localised insight, councils, health bodies and leisure providers can develop evidence-led interventions that address real community needs, design tailored campaigns to raise awareness or boost participation, and improve resources and allocation for inclusive infrastructure programmes. Next slide, please. And not only that, it will also help with monitoring and accountability. When outcomes are measured locally, it's easy to demonstrate impact back to funders and stakeholders. This was something that the steering group said that they would really value. It's enhancing sustainability and evidence that bespoke local interventions are delivering real change. It enables local monitoring and evaluation. And if we are to repeat the survey, it will allow tracking changes over time in disabled people's activity levels, attitudes, and well-being, and measure the impact of local investments or strategies, and showing funders and partners tangible outcomes. All this in terms of sustainability and ultimately the improvement of access to physical opportunities for disabled people will improve. Next slide, please. So empowering local advocates. Grounded in disabled people's voices, Get Yourself Active emphasises the importance of centering lived experience to break down barriers to physical activity. And local data captures the specific needs and context of communities rather than applying broad assumptions, which is fundamental in GYA's right-based consumer-centric approach. It builds stronger partnerships. Local survey data strengthens collaboration by giving disabled people's organisations, service providers, councils and active partnerships a shared evidence base, helping local authorities meet duties under the Equality Act and align with frameworks like Sport England's Uniting the Movement strategy, and encouraging joint bids for funding with solid community data. Next slide, please. It'll also help to reduce inequalities within regions and within specific localities. Natural averages can hide the fact that some areas are much worse or better than others, and the local data can help with that. It can highlight inequalities between wards, districts, or demographic groups, ensure rural, low-income, or minority communities aren't overlooked. A guide will able to invest where the need is the greatest. Next slide, please. So this slide is just a little bit of why localised disability data matters for Get Yourself Active. So if you think of the purpose of centering lived experience, so for our point of view, it empowers disabled communities and informs inclusive design. Designing tailored programmes, it reflects the real need on the ground aligned with local contexts. Equipping DPOs partnerships supports DPO-led capacity building and advocacy at community level. Improving outreach helps disabled people know what's available in their area, and demonstrating local impact strengthens cases for funding and sector-wise sustainability. So next slide, please. So in summary, without localised disability data, persons with disabilities risk being excluded from development, services and policy making. It's essential for equity, inclusion and rights-based approaches to disability. Without localised disability data, GYA's mission to enable equal access to physical activity can't be fully realised on the ground. Gathering data at a community level is essential for designing inclusive programmes, empowering local DPOs, ensuring visibility and building a robust evidence base for lasting change. Localising the Activity Alliance survey turns national insight into community-led action. It's a vital step towards generally inclusive physical activity for all. Thank you for listening. I'm not sure if we're doing questions here, Jake, or we're going to have them at the end. Happy either way.
I will pass on to James now.
Perfect.
Brilliant. Thank you, Laura and Rose. It's really, really interesting to hear everything that's going on. The use of all of your work for us as an active partnership is essential for us to keep moving forward. And actually, Laura, I think you've so eloquently put some of the things that I'm hopefully going to try and start to bring to life a little bit in my section. So can I have the next slide, please? Brilliant. So I suppose giving you some understanding on who I am, what we're all about. So I'm James Timmins. I'm the Health and Inequalities Officer for Be Active. As Jake said, we're the active partnership that covers Bedfordshire. For anyone on the call that isn't quite sure what an active partnership is all about, we are all about how we can create a healthier and happier community and county through the means of physical activity. So this might be how we can better support our community organisations and delivery partners with whatever they may need, or how we can then influence the wider system and those key strategic partners to start understanding that physical activity is the answer to some of the problems, and in my bias, a lot of the problems that the country is facing specifically and more often than not from a health perspective. Next slide, please. So I'm here today to talk to you a little bit about what the Bedfordshire Disability Activity Survey was. Earlier on this year, I put together the Bedfordshire Disability Activity Survey with a lot of support from the Activity Alliance. We've heard from Laura all about understanding our local patch and what that means and the benefits to everyone across the sector. And this was our attempt at trying to start that. I think we had felt like there was a really great opportunity at the moment as we're looking to secure some place investment from Sport England to really start to get to grips with truly understanding and identifying exactly what our community needs. So for everyone on the call across Bedfordshire, we work across central Bedfordshire, Bedford Borough and Luton. So when I talk about our community, those are the sort of people I'm referencing. So we sat down with the Activity Alliance. The ADAS, or the Annual Disability Activity Survey, was fantastic. It gave us that national understanding, but we really, really wanted to get to the heart of what our community wanted and what they felt like they needed. And if there was any services, organisations, providers or individuals that needed more specific support that we could try and influence and organise, whether that be working with local authority, healthcare professionals, or just those key delivery partners in our area. So with the support of the Activity Alliance, we adapted and developed their current survey to be more reflective and more relatable to our community. And we took this out to a local delivery partner that we've done a lot of work with in Luton that supports adults with learning disabilities, and ultimately tested. We made sure that they understood the questions that we were asking, they understood the ask of them, and they felt like they were able to answer them fairly, clearly, and relatably. All of this was about how can we understand the motivators, the barriers, and the true local experiences of disabled people across Bedfordshire. Unfortunately, we're now at the time where I've had chance to have a look through those responses and start to understand and thematically analyze those and pull out those sort of key themes and key messages that disabled people have fed back to us. Before I move on to the next slide, what I'll say at this point is if anyone is after a more detailed breakdown than what I'm going to give you after this, then please let me know. We've created or are in the process of developing a dashboard that's public facing that gives you an idea of who, from an age perspective, has answered, from where in the county they've answered, and then a more detailed response into all their questions. So if anyone is keen to see that information, then please let me know and I can share it with you. Next slide, please. So I've pulled together on these next few slides only just a selection of some of the questions that we answered and then some of the key sort of themes and responses that we received to those questions. There is more on the survey. It was a smaller document than Activity Alliance's ADAS survey, but I thought it'd be useful for you guys to have some understanding on what we sort of saw and heard. I think what I'll preface this is that it was not totally outside of the box, but I think for us that was really, really useful and really key for us to hear that actually the thoughts and opinions and the ideas that we had on what disabled people were experiencing across Bedfordshire, it enabled us to affirm our knowledge and realise that the work that we are doing in this space is the right direction of travel, and we're having the right conversations and we're supporting the right people in the right way. However, I think on these slides you'll see that I've tried to add in some additional comments and some key takeaways, some things that were slightly left-wing, I suppose, than the more generic and common answers, but things that really stuck with me and are going to enable us to sort of support the wider system. So I think the main thing that off this slide, you can see that 83% of people that filled in the survey across Bedfordshire felt like they were facing unequal access to physical activity, whether it be the deliveries were at unsuitable times, whether they had no idea where they could access the information around being physical activity, travel, understanding their condition. All of those sort of factors played a big part in some of the responses, but that 83% is a really powerful number for us to take forward and see if we can improve over the next 12 months. Next slide, please. Additional takeaways, as I said, that these key sort of themes and additional comments, I think for all of us on the call, we're probably full well aware that disabled people are experiencing these challenges, and the Activity Alliance, as I've said, have done a brilliant job of giving us that national perspective. But it was really apparent across our survey that some of the themes, if not all of the themes of the ADAS, were very apparent. They felt like there was an inequality right from early childhood. There was no age group that felt they had more opportunity or faced less access to physical activity. So there's a lot of work for us to do across the lifespan. There was a couple of individuals that filled in the survey that told us that they'd actually moved across local authority lines because there was slightly more opportunity in Bedford Borough than there was Central Bedfordshire. I think for our local authority partners, that's a really key thing for us to feed back and highlight to them, that actually they need to make a big change in supporting their community. And then they're not always aware, as a mainstream deliverer, for example, are not always aware on how they actually include disabled people. So not only do we need to support disabled people to have more opportunity, but actually that looks at how can we support those mainstream, in quotation marks, providers to become more inclusive and more accessible to disabled people, and realise it's maybe not quite as scary as a step as they may think. Next slide, please. Really simple and easy. This was just a slide that sort of started to look at what activity people wanted to try. The 6 on the screen were the most common. That's what we heard a lot of. However, I will tell you that I think I had over 30 or 40 different suggestions of physical activities that that disabled people would like to try, some of which we're able to signpost people to, but others of which I'm not aware of in our area. I've had conversations we're not aware of, so it gives us a really good perspective with this place investment we're hopeful to receive, to see how we can start to look at developing new opportunities for disabled people. So those sort of key things to note. I think what really stuck with me is that disabled people don't just want to feel like they can be active, they actually want to feel like they can compete, and they want to feel like there is an element of competition to sport and physical activity, and that although it's great us developing new sessions, how can we develop leagues and tournaments and competitions and allow people to really showcase their skills and their talents. I'm sure that we all hear swimming is a really big and apparent thing across Bedfordshire. I'm sure it is across the country, but it's all about pool warmth and the time of day that opportunities are happening, and whether there's lane swimming or open swimming, etc. And then predominantly from our female respondees, we saw that they wanted to have the opportunity to exercise in same-sex sessions. So 3 just really nice and clear and key notes for us to be able to take away. Next slide, please. So what kind of support would help them take part in physical activity was one of the next questions that we had. I do a lot. I have a really privileged role in that I have a lot of conversations with community partners and how I can best support them, but also get to sit at some of the strategic conversations. And some of the things that I've heard frequently and were very apparent that other people are experiencing across this survey was things in regards to the booking systems for local leisure providers only allow carers, parents, those responsible for disabled people to be able to book one session at a time or one individual at a time. And actually that then means that there's less opportunity for daycare centres, for example, to take more of their members to different sessions at any different time. Again, it enables us and provides us a resource and a powerful understanding to those leisure providers when we sit down with them to see how we can look at this and improve. Transport is a major issue across Bedfordshire. There initially wasn't a transport service in one of our local authority areas. Unfortunately, they're not there, and it's made it really difficult for people to be able to access opportunities that were there before and new opportunities. Adapted equipment, there isn't enough. We haven't got enough adapted opportunities for individuals. And then how can we look at making facilities more suitable, inclusive, accessible, and not just looking at it from a physical standpoint, but actually how can we influence planning, how can we influence building to make this part of regulation a big sort of key role that my colleague is forming a part of at the moment at Be Active. Next slide, please. again, I split this sort of down. There was a few different ways we could split this. I sort of split this into 4 things, and there was an element of public opinion and their expectations of disabled people. Disabled people felt like they needed to be taught at a slightly slower pace without being judged, and they weren't currently getting that. They wanted to feel more welcomed into new spaces. They wanted people to understand their condition right from the offset, or totally understand that they may need a little more time than others. They needed a bit more encouragement and understanding from deliverers, and they wanted an opportunity to be amongst each other as disabled people, with each other, befriending each other, and making more opportunity to be a part of more than just an hour physical activity. Next slide, please. So things we can do to address the barriers, and what they think that we could make a dent in and provide more opportunity to. Can we provide more sessions across the local authorities? Can we provide more opportunities? They want to feel involved and engaged in the planning and the delivery of these opportunities. They don't want to feel like people are just putting things on and not having the opportunity to be involved. And actually, as a part of this survey, we asked all of those that filled it in if they wanted to form part of our lived experience panel. This is a panel that our intention is not only we can tap into to ensure that we are doing the right things for disabled people, and we're giving them the opportunity to share their any future experiences and any other things that they would like, but additionally for all of our organisations, both community and system organisations, to be able to have conversations with and check and challenge and ensure that we're all pulling in the right direction and doing the right thing by disabled people across our patch. Upskilling the staff and the deliverers. Can we make it more accessible, whether that be transport or whether that be facilities? And can we make sure that information is more visible and people know where to go to be able to access it? Next slide, please. These were all direct quotes that I took from the surveys, which I thought was really, really powerful and will be a nice way for us to showcase to those higher system partners that they've got much more to do than maybe they realise. Don't treat me differently, just acknowledge my differences, I think was a really nice one, and one that I've used a few times since. Focus on providing disabled people with better experiences. We hear a lot around physical literacy and creating positive experiences for people. This was a prime example that disabled people feel like they're not having that opportunity in Bedfordshire at the moment. Price is increasing, but their benefits are not increasing, and physical activity is unfortunately the first thing that they're cutting from their daily life, which is not as an active partnership with what we want to be seeing. Things intend to be inclusive but are not always accessible. I think that's a really powerful one and really useful one, and we need to make it more exciting. Stop making it so dull. Can we think outside the box? Can we be more inventive, and can we provide more suitable and interesting opportunities for disabled people in Bedfordshire? Next slide, please. So this slide here, these are a few of the less common suggestions. I think on the last slide we saw some really key examples and really some powerful and common themes, but actually I thought it was just as useful to give some less common ones, and maybe that's as I said, an inventive way of starting to think about. I've already touched on the carers and service providers being able to book several spaces, and how can we make sure that social and befriending opportunities form part of physical activity delivery. Touched on the disabled person-led exercise forums, lived experience panel, etc. Can we create a non-intrusive symbol that highlights more support may be needed? They recognise that there is pins, but actually they didn't feel comfortable to be able to wear those. In leisure centres, this was specifically, can we have more of an identifier on someone that may need additional support or more opportunity or a bit more understanding that was less invasive? Someone actually wants us to petition to have larger scale physical activity deliverers to be mandated to have a disability offer. That could be a larger piece of work, but I like the thinking. And then how can we create more suitable environments for families to take part with their children, not just splitting family members up? Can we make it sort of more of that whole family approach? Next slide, please. Key learning. So this is a really nice thing, I think, for us to finish on. We are really happy that we've completed this survey, and we have full well intention that we're going to do this again in 12 months' time. But we're also really, really understanding that we could have done this better, and we could have made this a greater success. And there's things that we will do moving forward, and we'd like to share with anyone else that may be thinking about doing something similar to really factor into this. I think resource is essential, and I mean in terms of monetary and staff hours, time, commitment. We didn't create easy read copies. We didn't have things on websites that people can listen to the questions. I spent a lot of time trying to get myself out to places and support people with the filling in these surveys should they need it. Or we asked questions at the start of the survey. If anyone needed support, could they let us know? So we tried to counteract this, but I think that meant that we limited sometimes the people that we could really get to, and ultimately the people that we struggle to get to are the people we want to get to and we want to be able to support. They are likely not the ones that are not being physically active. I think we could have partnered with a disability organisation to help roll this out. So could we bring on board, for example, a disability resource centre that we've got in our area that are working day to day, minute to minute with disabled people to ensure that this forms part of their conversations every single day. The key system organisations, so for us individuals such as the ICB, the NHS, local authority, public health, we need to make sure that they have a role to play in the process. I've heard from all of them that they would like to understand the findings and have eyes on the findings, but actually I think they have a role to play to ensure that in 12 months' time, when we complete this again, they're ready to make a step and an improvement moving forward straight away. Can we make sure that this was an organisational priority? I took a lot of the ownership of this and as the health and inequalities team, and actually I think we needed to make sure that this was an organisational priority and that everyone across the organisation felt as comfortable with working on this piece of work as I may have, and ensured that everyone totally understood it and could have the conversations and share and promote at any given opportunity. Understand that language can be subjective and appreciate the feedback. We heard sometimes from disabled people that sometimes the language in there they weren't happy with. People didn't like the term disabled people and actually wanted to be a person with a disability. I think we went with guidance and support from Activity Alliance and other organisations, but I think that was just a key thing for us to understand that we're not going to get it right for everyone, and we just need to be receptive to that and best support them in any way we can. And really be clear in the purpose of the survey and make sure that you can say right from the very outset how you're going to enforce these suggestions. We heard a lot of feedback from individuals that said, why do I want to fill another survey in? I fill so many and nothing changes. So actually making sure that we could really demonstrate some of the things that we've already done and the things that we're planning on doing and the opportunities that we have to ensure that disabled people feel like this is worthwhile completing and worthwhile supporting. And I think that's me. So if there's any questions at any point, then please feel free to reach out to me. I'll put my details in the chat, and I'm sure Jake will share all of the slides and stuff after. But thank you for listening.
Brilliant. Thank you, James. And as James just said, please, if you do have any questions for him, for Laura, or for Rose, please use the chat function as part of this webinar, or contact them privately. We'll provide their details after this webinar or via the recording. So I wanted to finish up following James's learning, Laura's learning, and Rose's learning around how we move forward with this insight as an organisation, but also how do we support the sector moving forward. So thank you again to Laura, to James, to Rose for their time, for the presentation today, and also my sincerest apologies to anyone who has experienced technical difficulties as part of this webinar, especially those on the app where it seems to have affected how people are spotlighted in accordance with the slide set. And we'll be reviewing that in due course. But to move forward and to finalise and finish off this webinar, we have 5 key take-homes. So the first of which is how to address inequalities and adopting this through a person-centred approach. And this is especially pertinent From the findings of this secondary analysis for disabled people with mental health problems, disabled women, and those who are LGBT+, who have been shown to have the most negative experiences in sport and activity in relation to their opportunity, their enjoyment, and want to be active. Therefore, we encourage the sector to continue to explore how multiple characteristics of inequality are associated with negative experiences of being active, and we advocate for providers to review how their sports, exercise, or activity offer can be improved to meet disabled people's needs through adopting that person-centered approach when planning and providing for opportunities. In the chat, we should be providing some resources through a person-centered approach and our Access for All document, which has just been released this year. Thank you, Courtney. Second is to expand representation across the workforce. So from these findings, we know that older adults, disabled women, or those who are LGBT+, have the least opportunity to be represented in the physical activity and sport workforce. So existing research, which is the research into the workforce gap, which Activity Alliance released in January of this year, advocates for employers to adopt a flexible by default approach to job roles, provide advice and guidance for employers, and to proactively identify and remove barriers that exist in all stages of the workforce journey. So our programme Include to Improve, which is in partnership with Sport for Confidence, aim to increase the number of high quality, accessible opportunities for disabled people to take part, volunteer, and work in the sport and physical activity sector, of which the link should be in the chat shortly, if not already, in which we encourage organisations as part of this call and disabled people watching to engage with Include to Improve and to join our strategic partner network or our lived experience network to inform that programme moving forward. Our third key take home and moving forward with this insight is to further our insight and learnings across place, regions and localities, and further our understanding of what works across those regions, and we do so through our strategic partnership advisors who seek to understand what facilitates and more so prevents disabled people from the opportunity to be active, enjoyment and want to be active across their respective regions. We also seek to develop intersectional learning, and intersectionality is rather a framework for understanding how various aspects of one's identity, whether that's ethnic background, gender, social grade, can interact and create those unique experiences and privilege and aspects of oppression, of which James and Laura so detailed mentioned in their presentations, to advocate for lived experience and encourage partners to collaborate with us, Activity Alliance, so we can collect and use that data and resource and insight more effectively to inform the sector and support organisations moving forward. Fourth, and penultimately, is to develop that intersectional insight, and we'll do that through our annual disability and activity survey, which will be the next iteration will be released in June of next year, and we'll seek to support organisations such as Be Active and Get Yourself Active with gathering local and regional data, whilst encouraging partners to work in collaboration to share resources, insight and learning, as James mentioned. Furthermore, we encourage the sector to work directly with disabled people, ensuring that lived experience is central to highlighting inequalities, barriers, and opportunities for change. And that, as Laura mentioned, can be amplified by co-production, of which the narrative to co-production resource, as released by GYA and the UK, has been popped into the chat if you're not aware of beforehand. And finally, is to equip health and social care workers and ensure that an online information is relevant. And that ensures that we connect systems that advocate for health and social care professionals to be those effective physical activity messengers, whilst also championing the regions and organisations that offer excellent sources of advice for disabled people to be active. So equipping those health and care workers with the skills and resources to support disabled people is a key tenet in Activity Alliance's Manifesto for Change. And we encourage others to explore excellent resources that are already out there, such as Moving Medicine, Moving Healthcare Professionals, Moving Social Work, and as Laura mentioned, Get Yourself Active, the Social Care Activity Pack. Next slide, please, Jamie. So to finish off, we're just a little bit over time, but I'd like to thank you for your attendance today. We do have a feedback survey, which will be in the link, but you can also copy or scan the QR code. And we will leave this chat open for a few minutes so that if you do and able to provide feedback, that'd be most appreciated. If not, thank you for your attendance and thank you for engaging with this webinar today. And if you have any further questions, please contact us at research@activityalliance.org.uk or call the number which will be provided on the follow-up information moving forward. Thank you so much and take care, guys. Enjoy the rest of your afternoon.